All right.
Yes.
All right. So what we're going to talk about today is cancer and our pets, just in general for all of our focusing on dogs, not on cats. And I'm going to go over a little bit of the background of cancer, why we get cancer, some of the factors that, cause them, humans and pets to develop tumors, as well as how we can help in identifying our pets. And then going into a little bit of lymphoma, how do we treat lymphoma, and some of the options that we have. So it's just kind of briefly touching on all of those over hopefully the next about 40 minutes or so. Feel free to, I think that we were going to say, hold off the questions to the end if you guys want to write them in the chat. I might get to them as we go along, and I might answer those questions before we get to the end of the lecture. So just see. So the first thing that I'm going to talk about is we are going to talk about, sorry, I have to get everybody off of this screen. There we go. So the first thing I'm going to talk about is, how does cancer start? How does it grow and spread? And so we all have learned in our biology class back in high school about mitosis, about the interphase, prophase, and then how the cell separates in the telophase, and we ended up getting 2 cells. And this is just a part of what a cell does in its lifetime. This is where the actual division occurs, but there's way more that occurs at the cellular level. And the cell is really an intelligent organism, and that it actually has a very strict regulation and monitoring of the cell replication. So I put in here the top right picture that we have. This is what the cell cycle is. So we have the mitotic phase, where this is the division, and then you have cell growth, and then you go into DNA synthesis, and then finally back to cell growth. And during that, you can see that there's a couple of checkpoints here. They're called the G1 and G2 checkpoints. And these are where the cell stops and says, okay, is everything healthy? Are we okay to go into the next step? And if things are not healthy, then the cell will actually stop, and it will actually cause cell death, which is called apoptosis. And there's multiple points there. And, and then within that part of the replication of the cell cycle, we have these factors which cause, the cell to go into that next step. So we have growth factors, and then we have CDKs, which cause, which is apparently a tongue twister today. And they will actually stimulate that cell into synthesis, into replication, and to go to that next step. So we have this, go back to, we have the mitosis, and then we have the cell going through the cell cycle, which is regulated very carefully. And then we have other factors which influence those individual parts of the cell cycle. And within that, there's also a regulation of, the cell can go, or the cell can cause cell death, which is where a lot of the tumor development occurs, because that monitoring system is actually failing. So one of the most well-known regulators, and if you have a mutation in this gene, is called the p53 mutation. And this p53 is a tumor suppressor gene. And so what it actually does is it causes, it binds to the DNA. And as you can see, there's this little tiny picture. We all know that helix, right, of the DNA, and that this is our genetic makeup. And so this is what that, just to remind you what that looks like. And then this big picture here in the background is, you can see this helix, that's the purple part. And then the bluish part around it is actually the p53 wrapped around that helix. And what it does is it goes up and down that helix, and it actually monitors and looks for abnormalities, so mismatched DNA, and will actually repair it or send it into repair. And if it recognizes that there has been damage to the DNA, then it will, if it can't fix it, it will cause cell death or apoptosis. So p53 isn't the only factor that can, where we can have an abnormal cell growth. It's just one of the most well-known, well-studied regulators of tumor or cell growth. And if it, again, if it goes awry, it becomes a tumor. but it's much more complex than that. If it was that simple, we wouldn't actually have cured cancer by now. So there are a lot of reasons why we develop tumors, multiple factors, and they can be because of loss of these tumor suppressor genes, which we already talked about. We can actually gain function of a stimulator of the cell cycle, which will cause the cell to replicate. We can stop regulating at those points where we say, is the cell growing abnormally, or everything is okay, go ahead. There can be some genetic abnormalities. We know that there are some families, whether it's in people or in pets, will have a genetic component. They go ahead and they inherit an abnormal p53 gene or something else, and then they're not regulating cell growth properly. There are environmental factors. We know some of the food and some of the things that we're exposed to in the environment can actually cause cell replication that's abnormal. And so there's quite a few here. So I'm going to just focus on, we kind of talked about the loss of function of the tumor suppressor gene. Then we're going to go ahead and we're going to talk about a little bit about the genetics on the next slide, as well as obesity is a well-known risk factor for developing a tumor. So like I said, how does that tumor develop? Well, this p53 mutation is actually this Lymphoma syndrome. And the picture on the top right is the chromosome showing that the gene that has the 53 gene that has that mutation, which when a family has that mutation, then they're at a much higher risk of developing cancer before the age of 40. And usually they have usually 2 or 3 tumors that they develop in their lifetime. And because their body is not able to control cell growth. Another thing that we're aware of causing DNA damage is we're told to put on sunscreen. And that's because UV light, specifically UVB light, has a direct damage to your DNA. And it can alter and cause mismatch between your genetic makeup. And then it can also cause damage to your p53. And then the last thing that UV light can do is it actually causes an increased response with your inflammatory response, which becomes overactive and then can develop into tumors. And the last thing is that, just to kind of explain, how it's multifactorial, is that obesity can cause an increase in growth hormone and inflammation. And so this inflammation will lead to development of tumors. And so we know that people who are obese at a younger age and will have that stimulation of growth hormone through their life, and then potentially are at a higher risk for developing certain tumors later on. So just to give a little bit of understanding of how complex development of tumors are. And, it just reminds me every time I go over the cell cycle and replication, we know so much about it already, but anytime that we do a little bit of research, we realize there is so much more that we need to learn about the cell cycle and replication and the environmental factors that play a role in us of developing a tumor. But the focus of this talk is to talk about our pets and cancer. And we are seeing more and more pets develop tumors and more clients that are willing to bring in their pets to be treated for a cancer. 1 in 4 pets now will develop a tumor in their lifetime, and 50% of pets will be diagnosed with cancer. So that's a really high rate, and it's keeping oncologists extremely busy because people are willing and aware of what's going on with their pet and willing to treat them. And this is all information that the AVMA has collected. So why are our pets being diagnosed with more and more tumors? Well, the first reason is what they're considered family. I know that in my lifetime that pets have really gone from being in the yard and being outside most of the time to coming inside to sleeping in our beds. They sit at underneath the table, getting the scraps, hanging out with us. They've really become, they're not just pets, they're our family. And the next thing is, I mean, you guys are a perfect example of this, dedicated owners and breeders who are, really interested in our pets' well-being, and they're going to regular veterinary visits, they're getting vaccinated, they're having blood work done yearly, they're having dentals done yearly. All of these are, improving their day-to-day life, and they're living longer lives. And then the last thing is that we have better diagnostic tools. Frequently, I probably 2 or 3 times a week, I do a CT on a patient. X-rays and ultrasound and routine blood work are done daily at the hospital, and it's not uncommon. Most people have access to these advanced imaging, maybe not at their general practice, but they can be referred and have their pet have more advanced imaging. So what are the common tumors that we see in dogs? The most common one that I personally treat is lymphoma. Another common tumor that we see is mast cell tumors. And so this first picture is a picture you can see just under the base of the ear, that there's an enlarged lymph node there. On this dog that's standing on the table, you can see a mass that's behind his knee. That's actually a mast cell tumor. Another common tumor that we see in large breed dogs specifically, it's more common, but I have seen it in cats and in small breeds. But this is a lab that has osteosarcoma on his left forelimb. I should say this dog is celebrating his 1 year from diagnosis, and he was being treated, so we had a little party for him. And another common tumor is melanoma. This can be the most common place that is either going to be in the skin or in the mouth. So here you can see an oral mass that is very darkly pigmented, and that's an oral melanoma. And then the last one is the hemangiosarcoma. And this is a tumor that we typically see in the spleen, the liver. We also see it in the heart as well. So we know there's a lot of tumors that our pets can see, that can develop. So what can we do? How can we monitor our pets for these tumors? And when should we be worried? If our pets are getting older, we need to be, more aware of these changes that are going on with them. We all slow down as we get a little bit older, dogs and people. And when is it a time to, really go into the vets and get more workup and be concerned about what's going on? So clinical signs are really quite variable, depending on the type of tumor, the location of the tumor, and also how aggressive that tumor is. And so I've actually put 3 pictures up here that are of masses. And so that's the first thing that you're going to look at and say, I have, you see something, it's a mass. So, should we move forward and do, go to the next step? Should we bring our pet in for, a workup on that? Something else you may see is change in behavior, exercise intolerance, changing in the way that they breathe with the effort that they do, if they have abdominal effort, abdominal swelling, and weight loss. And these 3 images are, like I said, are 3 images of masses. And I wrote them, and I actually would be really interested in it for you guys to kind of just say, which one here looks like it's the most aggressive? So I've measured the first one and took pictures of the other 2. And I'm going to go into the next slide and talk to you about which ones are the most aggressive and which ones are the least aggressive. So when you see a mass, and this is one that we showing you again, all 3 of them. So we saw this mass here on the top image in this slide, and has this mass been there for a while? Has it been growing? If the answer is no, it's not been growing, then perhaps it would be okay to say, let's reassess it in like a month's time. Has it gotten bigger? And this is why we measure it and why it's so important, because, a difference in a centimeter on a mass like that is going to be huge, but it may not be something that you appreciate just by looking at it. So you need to measure it, you need to take pictures, and this is something for you and your vet to do. If this mass has been growing recently, if it's something that you have not seen before, then it should be something that you should bring in your pet for. If it's something that you're, all of a sudden, and your pets well. And when when I'm talking to pet owners and they're saying, I'm concerned about something, it's really important for me to listen to them, because you guys know your pets the best, and subtle changes can be really significant. So I feel like there's not enough information that you can share. Write down your concerns, because once you get into the vet's office, you're going to forget once we start talking about, oh wait, I forgot to mention I was also concerned about that. In addition to, if the mass has been there for a year, if it's started to change recently. So if you've been palpating, it felt really soft, and the vet has done a fine needle aspirate, and it, said, oh, don't worry about it, it's just a fatty tumor. But then it starts to change in how it feels. I would then say, let's go and get this worked up. Let's take some samples. Let's see if there's something more going on. Then another thing about a mass besides it growing is it ulcerated? So as you can see, there are, this one on the lip is actually ulcerated. If a mass is very firm, as I mentioned before, going from a soft to a firm mass, that would mean that I was concerned about it. And another thing about a mass that would be concerning is that pet licking and chewing or scratching at it? Are they bothered by it? Does it seem to be irritating? And it doesn't always come across as it being painful. So this dog with the ear mass was actually scratching and rubbing his ears for a very long time. And these masses and how serious they are is actually the most serious one. The one I'm most concerned about is the one where we have the calipers measuring. That's the most aggressive tumor. The next one I'm concerned about is the one by the nose. And the least aggressive mass out of all three of these is the one in the ear. And the reason for that is that this dog was, because it was irritating, the dog was scratching, it actually grew and became inflamed and ulcerated. And then they did a surgery. The first surgery didn't remove it all. And so it just became more, it looks worse than it is. They biopsied it and it came back as a low-grade mast cell tumor. And once we removed the mass, which included removing the ear flap, this dog has a really good prognosis. I'm going to actually go into showing the tumor with the calipers in a little bit. So other signs that we're going to be looking for are changes in behavior. So really anything. Like I said before, if you're concerned, then go to your vet. I'm concerned, thinks this isn't how he is. He's not sitting the same. He's like pacing more. Those are signs that something is going on. Eating less, drinking more, things like, if they're having kidney issues, whether it's because their kidneys are not functioning as well, or is it because of side effects from the cancer? Those are all very concerning. Exercise intolerance. And this is a really challenging one to really, as our pets get older, when they're starting to become senior pets, they are going to slow down. But when there is a significant change in a short period of time, I think that's very telling that there's more going on. And changes in breathing, increased effort, increased rate of breathing. Sometimes they're not as obvious if they're have an increased rate, but look at them when they're sleeping. Like, is it, are our pets sleeping well at night? Are we able to have a good night's sleep? Are we getting up and pacing during the evening? And then finally, a couple other things are if you see a swollen belly, or if you have a significant or even a slow weight loss. So when we have a tumor, we can develop something called cancer cachexia. And what is happening is that we're actually, the pets are eating the same amount of food, but their tumor is growing and requiring more energy. And so they're actually fighting for energy and out competing the healthy cells for energy. And so what happens is they actually can be eating very well, but have a weight loss. And this can be mild, or it can actually be quite severe, where they go from being having a little extra to seeing their ribs over a short period of time. And but if you're, you know, most people are keeping an eye on their pets, watching them, and if you start to see, you know, even, you know, a half a pound, you know, over a period of time, is okay. Let's reweigh and see where we are in a couple of weeks. Are we continuing to lose weight? And this is concerning. So what's your next step? You have some concerns that your pet has something going on and that it may be cancer. We need to start investigating. And a lot of people will come into an oncologist and say, well, I told I was concerned, and, you know, we did blood work and the blood work was fine. Well, blood work can be actually quite deceiving. My own dog was diagnosed with a liver mass and had completely normal blood work. Even the liver values were completely normal, and she had a ruptured ruptured liver mass. So you can have some normal values and have cancer there, but it does rule out a couple of things. So blood work is going to tell us, you know, if we have a bloodborne cancer, so if we have leukemia or if we have stage 5 lymphoma, you may be able to pick up on that with your CBC, which here on the top blood work, you can see the HCT 0.35. So that's the hematocrit, which is a little bit below normal of 37. And this is sometimes a sign that we have a chronic disease going on, but not very specific. And the other reason why that we're going to recommend doing blood work before we go ahead and, you know, start doing a workup is we want to know, you know, what is the overall health of our pet, because we know that most of our pets that get cancer are going to be over the age of 10, and they may have other health issues. They may have heart issues, they may have kidney issues. And so here I have a chemistry from a pet that was diagnosed with lymphoma, and the kidney values were elevated. And so, you know, we are able to alter our, you know, sedation that we were going to do for staging. We were also going to alter how, what drugs that we would give for to treat the cancer that this pet was diagnosed with. So this all maybe won't tell us what cancer we have or what illness we have at that point. But it will help us manage and treat that pet from that point onwards. So it's really informative and really helpful to have that information at the beginning, even though it didn't give us a diagnosis. So the next thing we're going to do is something called a fine needle aspirate. The fine needle aspirate is just what's describing the technique of actually getting a sample. And it's here we would always take and measure the mass, and then we would either use just a needle or we would use the ultrasound machine to go after a mass maybe internally, so that we can go ahead and get a sample. And getting a cytology, once we get those cells on that needle, we actually put it on a slide. And these are 3 examples of a cytologies that we would, results that we would get. And it's a really easy technique, usually minimal side effects or risks. But as you can imagine, we're only grabbing a few cells, so it's not always diagnostic. And it can also be really difficult to say that, you know, this truly is what's going on at that cell, or may not be representative of what's going on at that in that mass. And so the picture on the top right, that's a mast cell tumor, and you can see there are large cells. They're quite variable in size. And yes, I can say that is a diagnostic sample. But if you look at the one on the bottom left, these are the neoplastic cells, the cancer cells. And they are only a few. The majority of them are red blood cells. So they're not really, I'm not going to be able to, with confidence, say that this is truly a neocancerous process going on. And so I'm going to need to do some more diagnostics to come up with a diagnosis. In addition to it being a small sample, sometimes if you have an infection going on along with the tumor, you may not be able to you might get infectious bacteria or white blood cells fighting off that infection, and they might be more numerous than your cancer cells. And that will make it challenging for the pathologist to make that diagnosis. So that's when your vet's going to say, let's get a biopsy, which we can do in lots of different ways. And I have a punch biopsy. You can actually, we can take percutaneous samples, which is the second picture here. And then we can actually take a piece of it and without removing the whole tumor to get a diagnosis. And even that's not 100%. So sometimes we will have to take those samples and run special stains on them. And so as you can see here on the bottom row, I have 4 pictures. So this is the same tumor, and those are all a histopathology of a mast cell tumor. But you can't tell if that tumor on the one that is with just H&E on the left is how aggressive that is. So we put this special marker stain for looking for mutations on that cell. And what happens is this brown stain will actually be picked up by a receptor that's promoting cell growth. And as you can see, there's a huge difference in between C and A. And C is a really aggressive tumor, even though you can't really compare it as far as the size. The nucleus is the same size, the cytoplasm is the same size, but there's a lot of that receptor there promoting cell growth.
Oh yeah, I'm good. Thanks. Go see them.
Okay. You had a question? No, okay. So the next step after we have a diagnosis is going to be doing imaging. And we are going to recommend a variety of imaging depending on the tumor. So we're going to potentially do x-rays of the chest. Here we have actually an interstitial lymphoma in the chest. And then I have a picture of an x-ray of the leg when we have a bone tumor. We may want to image specifically just the spinal cord with the vertebrae. We may also want to take x-rays of the abdomen. And then abdominal ultrasound, and abdominal ultrasound is going to be evaluating, so it's not just a picture, it's going to be a moving image so that we can take video. And here is an image of an ultrasound of a spleen. And at the top is actually like the fat and the skin. And if the probe is going down, you can see it goes from kind of a brighter white area. And then it goes into sort of a darker area that has sort of, you can see some dark vessels going through, but it also kind of looks like there's little punched out lesions kind of throughout. And it's very subtle. It's hard to see on this picture, but this is of a spleen that has lymphoma. And as you can see, the ultrasound of the spleen, I, from experience, know that it's most likely going to be a splenic lymphoma, but I absolutely would take samples, but I can't tell how big that is just by doing an ultrasound. So we're also going to recommend to do radiographs to do the size of the spleen. And that's why sometimes we actually end up doing more than one image. Other things that we may do is recommend CT. So on this dog, we looked at the mass, and I said that was actually the tumor that I was most concerned about. So I did recommend doing a CT on this patient. And the reason why I was concerned about it and wanted to do a CT is because we could only palpate on the outside, and it was a very firm mass. So I was concerned how deep it was going. And so we did a CT, and these bottom 2 images are a CT with contrast, which are, if you've probably never seen a CT before. So at the very bottom right of both pictures, you can see a very large sort of triangle shaped mass. And the first one is without contrast CT, and then the second one is a CT with contrast, which highlighted the tumor. And then if you've seen CTs before, if you look in at with the contrast, I can actually see that there is some necrotic areas or highly vascular areas. And so those are going to, tell me, I shouldn't take samples from there because I'm unlikely to get a diagnosis from the necrotic areas. I'm taking a sample, I will avoid those. I did have confirmation this was a soft tissue sarcoma. This is just a screenshot. When we did the whole imaging of this dog, we found that this mass that started out from his shoulder actually went back about, I think it ended up going 7 centimeters back. And this dog was only probably about a 30-pound dog, maybe 35 pounds. He was a small dog. So he had an extremely large mass, and it was not surgical. So another, just to show you that MRI versus CT, the image on the left is CT, the image on the right is MRI. As you can see, this is the exact same location and how different they are. And again, just to show you why we might actually end up recommending both of those images. So that's just to kind of go over all of the what to look out for, what tests we should talk about doing, and why we would do them. And then I'm going to talk a little bit about lymphoma. So I'm just going to have some water first. So what is lymphoma? Well, lymphoma, first of all, is the most common tumor that I have ever treated. And I've been doing oncology for over a decade now. And it is absolutely the most common one we see, and is fortunately one of the cancer that is most responsive to chemotherapy. And so lymphoma is a cancer of a specific type of white blood cell, lymphocytes. And white blood cells are involved in fighting infection. And there are actually different types of lymphocytes. So lymphocyte is a white blood cell, but there's actually a B cell lymphocyte and there's a T cell lymphocyte. And those are just two examples. And they are located pretty much anywhere in your body, but they really like to be in your lymph nodes, in your spleen, and in your bone marrow. And so here I have an image of where the nodes, the most common palpable nodes are. And so we have the one under the jaw that most people, if they've seen or had a pet with lymphoma, have felt. They also have one in front of the shoulder and then behind the knees. And those are the ones that as owners that we're going to, if they are enlarged, are going to probably palpate first. But like I said, lymphocytes can be anywhere in the body. And so as a result, so can lymphoma. And there are over 30 types of lymphoma described. So it's not just lymphoma and just that simple. There are actually many subtypes of lymphoma, or many different locations, et cetera. So typically, the most common way that lymphoma presents in a pet is that we have what owners will say is they have a mass under their jaw. And so they have that mandibular lymph node becomes enlarged. And that's where this dog, as you hear, right underneath his ear, has an enlarged submandibular lymph node. And they often the owners say, well, I've noticed the mass, but maybe a little less energetic. As I said before, maybe that could be because of anemia. But we really thought that he was slowing down because he's slowing down because he's a little bit older. He's 10 now, so we didn't expect him to be running up and down the beach. So really can be quite vague. Other signs that you may see if a pet has lymphoma, and this will really depend on the area that the lymphoma is affecting. So if we see vomiting or diarrhea or weight loss, which we would call gastrointestinal signs, is do we have lymphoma in the intestinal tract? Do we have a lymphoma in the stomach? And those would then show signs of having vomiting, diarrhea, and significant weight loss. Another clinical sign that they may present is that they have these skin rashes, skin lesions, really dry, flaky skin, very pruritic. If they have cutaneous or skin lymphoma, and this is on the bottom left, this was a patient that we treated for almost a year that had cutaneous lymphoma. And I think one of the biggest issues that we have is that they are constantly itchy and scratching, and then they get secondary bacterial infections. So you're always trying to make them as comfortable as possible. Another sign that a pet may present with is that they're drinking a lot, and that a pet who is older all of a sudden starts having accidents in the house, and that it can be intentional, or they can just be drinking so much that they have accidents in their sleep. And what happens if they're doing this because they have lymphoma. It's because lymphoma, and a small percentage of the T cell lymphomas, they will actually produce a hormone which will cause an increase in their calcium, and that causes them to drink more and urinate more. And as they get older, it's just a little bit harder for them to control, so they have accidents. So as I mentioned, there's a lot of different types of lymphoma, and the prognosis is really dependent on the location of that lymphoma. So we mentioned it could be in the stomach or in the intestine, but it also can be at that central nervous system. It could be primarily just in the liver, and we've also mentioned the skin. But the most common one we do see is that multicentric lymphoma. And like I said, that's the one that kind of presents with the enlarged lymph node under the ear, and also, or at the base of the jaw, and then in front of the shoulder. So we talked a little bit about how we would work up a patient if they had lymphoma. What are we going to recommend? If you see these in your pet, immediately bring them to the vets and have them do a needle aspirate and submit for cytology. This is a very simple procedure, and your vet should be able to do it. The great thing about lymphoma is, so I told you a lot of times we don't get an answer with doing a FNA and cytology, but with lymphoma, it's rare that you actually don't get a diagnosis, because these cells are we call them round cells, and they exfoliate very easily. So once that cytology comes back and you get that diagnosis of lymphoma, don't panic, because there's a lot we can do for your pet. There are many options. So, but usually when we come and we give that diagnosis, and I've done GP as well as been an oncologist, and the first thing, and I get asked, one of the, even as an oncologist, is, what did I do? How could we have prevented this? And the truth is we don't know exactly how our pets get lymphoma. We know that there's many factors. We've talked a lot about that. We know that it's not contagious, but we do also know that there's a genetic predisposition. So if I have a dog that's a purebred, and I will tell them to go back and let their breeder know that, my dog was diagnosed at lymphoma, especially if they're younger. If they're diagnosed at 4 or 5, then there's an increased risk that there's going to be some genetic component to it, and that we're going to, want to keep track of the other offspring to make sure that, where did this come from in the line, so that we can prevent it from happening. And often it's just spontaneous, it's not something, yes, they have an individual component, but it's not like it was something, from being overbred or something like that. There is a big study being done on identifying how we can, breed out some common tumors. And so they're collecting a lot of data. When I was a resident, we did a lot of samples and submitted them to the Morris Foundation, so that even to get banks, so that once we identify something, we can go back and research this. So there's a lot of research going on how we can prevent this in the future. So you get the diagnosis of lymphoma, and the question is, should you see a specialist? I would recommend you see a specialist if you can. There are not many, and it's not always available. There's a little over 400 of the American College of Veterinary Internal Medicine. I do not know how many there are in the European College of Veterinary Medicine, but it's a very small group, and so there's not many to go see. But if you have that ability, I would go and at least have a consultation. They're the most up-to-date on treatments, and they're going to be some new drugs that have been developed. They're going to know about different protocols. I mean, I'm constantly talking to, I finished my residency a long time ago, and I still call and in email and text my friend and say, this is my plan for this patient. Is there anything else that I'm missing that we should do? Then, oh, we did this, we tried this on this patient and it worked really well. So we have a really small group and we really work well together. I always make this joke when clients come up and say, well, they want questions about, flea and tick. And I'm like, I have no idea what to do for that. I'm so focused on what I do that, if you want to treat cancer, come see me. But if it's anything to do with basic healthcare, I am not most up to date on that. So you should be going to see your general practitioner for that part. And a lot of general practitioners are not comfortable doing chemotherapy. So you can see that this is a picture that I took at Michigan State. They are gowned up in full PPE, mask and gowns and gloves. And we're really, really safe about how we do this so that we're not only treating the pet, but we're also safe and being careful and not exposing our staff. We can work with your vet to do staging and to do, blood work in between treatments. So, it's not like you just come to the oncologist and we don't work with your vet. We absolutely will, because you have that long relationship with them. And it's not that we want you to leave them. We're very happy to work with them. So now that we have that diagnosis and we're talking about, we'll go ahead and we'll recommend advanced imaging to find out the location. I mentioned that there's that specific type, what type of cell is it, B or T cell? That may require a very specific flow test or something called PAR, and that will help us further identify what type of lymphoma it is. And then I've listed here just the stages, stage 1 through 5, and how many nodes are involved, how many organs are involved. And again, all of these things are going to play a factor in what do we do with that next step. So why is it important, in addition to know how to help with our treatment plan? We already mentioned, sometimes we find out we've got heart disease or we've got kidney issues. And so overall health of that pet. So many reasons why staging it is so important if you can do it. And the other reason why, it's the first time I'm saying this, is that once you have one tumor in a senior pet, you're at a much higher risk of finding a second one. Whether it be a benign tumor or a malignant tumor, you're at a much higher risk of developing a second tumor. And so now we have all of the information and we can talk about the treatment options. And there are a lot of options out there for lymphoma. The most common one is called the CHOP protocol. And this is a multi-drug protocol, and it's made up of these 4 drugs, cyclophosphamide, doxorubicin, vincristine, and prednisolone. There's a variety of ways that this protocol can be given, and it's usually the same. It's just the frequency at which you do it can be increased. I personally do the 26-week protocol, which is what this sheet right here is on the right. And that is, I have a lot of reasons why I do it. It's a real more personal. The survival time, the response time, there is no difference between the 16, 19, or 26. It's just a personal preference on which one the vet will do. There are other options too to consider. If we find out that you have a T-cell lymphoma, we may recommend that you do Mustrogen or MOP protocol, which would be Mustrogen, vincristine or vinblastine, prednisolone, and procarbazine. And this also can be used in resistant B-cell lymphosarcoma patients as well as a rescue protocol. And then the second one that I've listed is a fairly new drug. I think it's about 5 years old now, Tenovia or rabaxfosine. This is more effective against B-cell lymphomas. So we would use it if I had a T-cell lymphoma. I probably wouldn't recommend it as a first line. And I would also use it as a rescue though for T-cells if and when we reach that point where a patient has stopped responding to the old protocol. And then the last one is a single oral treatment called lomustine. A lot of clients will pick this treatment because they only have to come to the oncologist once every 3 weeks. And it can also be combined with other drugs. So not only is the type of lymphoma, the location, the phenotype, what's going to help us come up with that protocol, but also how is that pet and what can the owner do? And how often can they come in? Cost is a big factor too that we need to take into consideration. And so every time I have that first conversation with someone about the lymphoma treatment and what is the option, and it's like, These are the gold standards. This is what your pet has. This is what I would recommend. But we take it week by week. We see how do they respond. How is this working for you? Is this too hard for you to bring your pet in? Because if you're stressed, your pet is going to be stressed, and that's not the right decision. And so every patient is different, and every treatment plan is completely different. So if you see a mass, or if you are concerned at any point about anything, you should see your GP vet. You know your pet best, so go ahead and recommend, I want some diagnostics, I want to investigate. If you have a diagnosis of any, whether it be a medicine or a cancer diagnosis and you want to go see specialists, ask for that referral. Lymphoma is one of the most chemoresponsive tumors in veterinary medicine. So if your pet has the unfortunate diagnosis of lymphoma, there are a lot of options out there. But not only with lymphoma, there are a lot of treatment options available for a lot of different types of tumors. And pets tolerate chemotherapy very well. We work to make sure that they have the best quality of life while they're receiving chemo. My goal as an oncologist, and all the oncologists that I know, is that your pet has an excellent quality of life for as long as possible. Hearing that diagnosis, hearing about chemotherapy is scary, but their quality of life is prioritized, and we really try to make sure that if there's any tough days, that they don't happen that often. So that being said, I'm actually done with my talk. I hope that people are still awake. Thank you so much for listening. You guys have any questions?
So could I ask one quick question?
Sure.
In reference to ponds, I would imagine that there are certain breeds that are predisposed to lymphoma. In your opinion, are ponds predisposed to lymphoma?
So I have treated a few ponds for a variety of cancers. Lymphoma and an anal gland, anal sac adenocarcinoma are the two that I have seen the most. So out of all the breeds. So I do think lymphoma, they're at a little bit higher risk for those two. But, again, it's the most common tumor that we see.
Right.
And we see it in a variety of breeds. So it also has an obvious, mass usually on their neck. So it's something that owners can see because they're going up and they're petting them, they're sitting on them, they're lying on, the pets are lying on you. And so is it a tumor that we're just catching a little bit earlier? And we can also catch before they get really sick.
And is that what you call stage 1?
So stage 1 would be just one node.
Okay.
Stage 2 would be if it has like a local, let's say have more than one node, but if it's like in their neck and in their shoulder. But if they have more than that, if they have a lymph node on, all their lymph nodes are enlarged, it would then put them at a stage 3. I've never seen anything less. I've probably seen a couple of stage 2s. I've never seen a stage 1.
So if you find a pet having lymphoma, and let's say stage 2, 3, what, in your opinion, is the life expectancy of that dog then? I don't know if I'm being fair asking that.
No.
Okay. Can I say something? This is Dr. Cindy. When we got out of veterinary school, we got a DVM or VMD. We didn't get a GOD.
Sorry.
And to be able to say something like this, we don't have the ability to. Okay.
Yeah, so you're absolutely right. And I read a really good book that I tell all the students to read, When Breath Becomes Air.
I read that. Yes.
I read it too.
And it actually changed the way I practiced medicine, in that his oncologist refused to tell him this. So somebody was diagnosed with cancer and his oncologist refused to tell him any survival time. Then he was a doctor himself. So
right.
For those who haven't read it. And that's the one thing I am proven wrong every single day. So when someone says to me, my pet is going to live, how long are they going to live? And I honestly say, there are a couple things I look for. Do they respond to treatment? If it's a lymphoma and they don't go to remission in the first 3 weeks, we're not talking about a year because we've tried all the drugs. So I really, there's too many factors for me to say, oh, and they do talk, you know, it's actually published that they say the average survival time is 10 months, 10 to 12 months. For which lymphoma?
Lympho.
That's not a therapy.
Lymphosarcoma.
Yeah, my.
Okay, but I
was
must
just
tell you
curious.
something. I must tell you something. Your presentation was great. And I'm gonna like pick your brain later. But the thing is that all of us have to understand that when we're dealing with something like this, we have to do the best we can. You go to your regular vet. Like me, if there's not a lymphoma on the penis, I have no idea how to handle it because I'm only a penis person. But when you find something and it doesn't look right to you, you need to go to an oncologist. And should your veterinarian not want to send you, you need to find a new vet. Okay.
I mean, I think that's true. If you went to your doctor and your own doctor and he didn't listen to you and you weren't feeling well, you would advocate for yourself and be your pet's advocate. And I do listen and all the time to my patients, their owners, and say when they tell me something's a little bit off, I believe them. I mean, most of them I would agree when I see them that sometimes it's not something I see. So advocate and push for more work, for more diagnostics. Absolutely. I think that's the biggest thing because you know, like I said, I don't know what flea and tick products to give anymore. I haven't a clue. So, you know, if it comes to cancer, an oncologist is where you should be.
But you need to find a person that understands and that listens as you are, okay? Because, you know, there are so many people that don't. I can tell you that I graduated over 40 years ago, okay? And when I got out of school, I had some incredible people at the University of Pennsylvania. And we were doing like a mini CHOP, okay? And when I listened to your lecture today, you guys have gone so far beyond that. I looked at those drugs and you talk to the client, you take them through, this is what we're doing, this is where we're going, these are our options, and this is what may happen.
Mm-hmm.
And, you know, that's the big thing is that, like I said, we're not GODs, we're
What time am I late
DVMs.
on? I'm leaving.
We're not DVMs, we're GODs, okay? No, I never. So guys,
do you have any other questions or?
Yeah,
Sorry, I didn't mean to cut you off.
I have a question. I think I'm not muted. Can you hear me okay?
Yes, we can hear
Yes.
you.
Okay. This is it's a little different, I guess. Are they doing anything with antibodies in dogs? And I bring that up because my partner's had lymphoma 3 times. Twice they gave him chemo. This time they said, no, we're going to give him antibodies. And not been able to apparently get rid of the lymphoma, but it's been very controllable with antibodies. Are they doing anything like that with dogs?
So we have been trying to do that. We haven't been very successful thus far. We were involved in we do have some vaccines, and we know that working with your immune system is the way to move forward with treatment. But we are far behind in what we do with people. But we are working on all the things that they're working on in the human side of things. We're doing in the veterinary side. We're a couple of decades behind, I think.
Gotcha. Well, I know I'm amazed at all the drugs they have. About, I don't know, several years ago now, I had a dog. I lost her at 9 to lymphoma. And I had one option. I mean, there was one chemo treatment available at that particular time. And I opted not to because she was too seriously ill.
Yeah.
They said maybe 6 months of that because she was quite bad. I'm dumbfounded when I saw the drugs that you listed.
I mean, when I mentioned my own dog, I did not treat my own dog when she got diagnosed. It's not always the right decision to do that. And I have.
Yes, it is. Yes, it is.
Yes, it is what?
don't treat your own dog.
No,
Talk
I
to
said
your
it's not
friends.
always the right decision to make that decision. Just because you can do something doesn't mean you should. So you have to do what's best for you and for your pet. And I would have sat and obsessed over my dog, and she would have been so miserable because I would have made her life miserable. So it was the best decision for me not to do it. And so people make that decision not to treat. I fully support them. And I am a huge advocate for palliative and hospice care, which I don't know if you remember from my PA days, but I am very passionate about managing and making patients comfortable for as long as possible. Doesn't always mean that we should be giving chemotherapy. So, and there's a point I will say stop. Even if you're not ready, even if the client's not ready, I will say stop. And make sure you, like, if you guys ever end up, if your dogs ever end up having cancer, and I'll need guidance when I have a lot of clients that say I need guidance when it comes to the end. And I said, we don't need to have this discussion again. I'm glad that we did, but I'm going to come in here and I will tell you no more, that your pet is suffering and we need to stop. And I will help you with that, because I'm not working for you. Even I know you're paying for the drugs and all of that, but I am the advocate for your dog. And when your heart is in it, your mind shuts down.
Wow. Well, I can tell you right now, I have a 15-year-old, my breed is collies. I've had other breeds, but my breed is collies. But I bred smooth fox terriers, and I have a 15-year-old that has small cell sarcoma.
Mm-hmm.
And this dog, he's 15 years old, and my oncologist is my best friend.
Yeah.
I mean, this dog is doing so well, and it's only because of her. It's only because of her. So, I got to give you kudos, girl. I know that it's not the happiest disease in the world, or diseases, but the fact that you can talk to the clients and educate them and give them their options, and when it's time to say stop, you are able to do that. You are really Wonder Woman. Okay.
I don't want to take a lot of time, Amy, but I have one question. Again, it may be a redundant question. Back to ponds. They love to eat. You know that. They steal food. And so wait.
Still remember the story. Yeah.
Yes. He tells that everyone.
And I'm still angry about it 15 years later.
So weight, when you mention weight, obesity, and that's something I think all the pound owners here will agree that we're constantly dealing with weight. And I do even more, and I'm sure Benin does, because our dogs are involved in obedience, doing jumps and all stuff like that. So what can I do? What is the least I can do to prevent? Do we keep doing exercises with them to keep the weight? And he's 7 years old. I'm concerned about his bones.
So it's a tough balance. I mean, you have to feed them a high quality food, but I know that they're stealers, and I know that they like their food. But really it's more so when they're younger than at like 10. Okay. But I would rather see a 10-year-old have a little bit extra than me under. But they're so active. Even like my dad, I said it was like 12 and a half, he's still very active. Now he goes to doggy daycare once a week, and when he comes home, he sleeps for like 2 days now. But he does that for him to keep him fit. And it makes a huge difference for him. I think doing those things and them guiding, I even say this when a patient's receiving chemo, like make sure you just take them on lots of walks to keep them active, because that will help their joints as well, not overdoing it, and listen to them. But you guys are here. You don't need me to tell you that. You're already on top of it and paying attention to your dogs. So, but it's most important when they're not, it's important when they're older, but it's most important in the younger years.
Okay. Thank you.
And I can tell you, because I've also been a general practitioner, that when I see a dog come into my office and it's obese, I know we're going to have problems. It's just like a person. So if we can keep our dogs looking beautiful and being the right weight and being exercised properly, we're going to avoid a lot of these health problems. Okay.
There's a lot of evidence within the breed that if you're using kibble, a lower protein and proportionately lower fat, it tends to result in fewer health issues. And not all owners are aware of that. We try to educate owners, watch your protein, watch your fat. If you're feeding at a very young age a protein that's too high and too much fat, then very quickly you will have obesity showing up and other health issues as well.
The thing is that we don't want to put our dogs in a situation where they're going to get cancer. Okay.
Right.
And one of the things that we learned today is that obesity is not our friend. So, you know, if we watch our diet, that's one thing we can do. Okay.
So I just want to, you're talking about, and you're absolutely right. There's a lot of studies that show that high protein, low carbohydrate diets are much better for diets. We truly know that. And when I get asked when a patient is diagnosed with cancer, should we switch them? But I actually say no. There are actually some cancer diets out there. It's different when a person is being treated for cancer and you can say you have to eat this, it's better for you. But as you will probably know, someone who's been diagnosed with cancer at this point, that your taste changes while you're on chemotherapy, that you're not feeling great. The last thing you want to do is be thrown in a new kibble to try to switch to a new diet. So it's my personal recommendation. I recommend eating a well-balanced food, then trying to switch and make sure that they eat this low carbohydrate, because what's going to happen with the low carbohydrate diet is that they're going to actually be less interested in eating that food. It's not as palatable. So ideally, yes, and starting them on a younger, healthier, balanced diet, you know, younger, it makes, I would say is much what I would recommend. But when they are diagnosed with cancer, I feel like it's not going to make a difference. You know, people were talking about living 20, 40 years after your diagnosis, living with cancer. Our pets are probably going to live 2-3 years. I mean, I have a few patients that have lived 4 years. A few even longer than that. But yeah, I have a couple lymphomas I have a lymphoma that was diagnosed 4 years ago. I have 2 lymphomas right now that I'm treating that have relapsed. They were diagnosed 4 years ago.
Wow, but 4 years
It happens.
is a great time.
It does happen. It's pretty rare.
4 years is a great time.
Yep. But also remember, I am treating 10 patients a day. So that's still a small percent that are doing that well.
And I only do babies. You know, I do babies and I do all that kind of stuff. But I must tell you, I agree with you totally. I think we need to look at the overall dog and say, what are we doing? What can we do to make their lives better and to decrease the possibility of getting lymphosarcoma, hemangiosarcoma, mast cell, whatever? What can we do?
Well, I think we're already doing a lot, and that's the reason why we're seeing this. Like I said in the beginning, we're doing so much to care for our pets. I mean, you guys have all, like, you know, we were talking earlier, have our ponds live such long lives. So we're already making sure that they get the best care. And that means by taking such good care of them when they're younger, that they're 50% of them are going to get cancer as they get older. And then we do the best for them and make the right decisions for them, because not all dogs are suited for chemotherapy.
I'm sorry, I didn't mean to interrupt. There's a question that's come in, question or two from, I think, Ingrid. I don't know if everybody can see that.
Yeah, I can read it as well. So it says, is the color a genetic thing with cancer? It says, absolutely. We know that pigmentation is associated with some tumors. I am not aware of anything with lymphoma specifically, but we do know pigmented is associated with melanoma, or lack of pigmentation is associated to squamous cell carcinomas, because they're more susceptible to UV light, and we don't put we don't put sunscreen on our pets. So there absolutely is a color thing. I actually, before I did cancer, did research in hearing loss and Jack Russell Terriers. And we know it's also associated with Dalmatians.
Really?
It's,
Okay, sorry. Okay.
it's associated with hearing loss as well if they have a patch. So I would say that there is absolutely, there's 100%, they're going to be at risk for, and my dad's dog is a lighter one. So he'd be much more susceptible to a squamous cell, but he has very weirdly pigmented gums, so he might get melanoma. So, and then the other question was diet, vaccination, and environment. I'm not sure.
Oh, please go. Please do that.
Carol asked that question. I'm not sure.
No,
What that
please do that, because I want to know what you.
I'm
how
not
you
sure
feel
what
about
the
it.
question is. Cheryl, can you explain what exactly the question is?
So one thing I should say is that if your pet is diagnosed with lymphoma, no more vaccines.
An environment,
And no vaccines is if you're getting chemotherapy treatment, because you're a vaccine is whole. We've all learned all of this, the science, and I never had to I always had to explain what PPE was, and I always had to explain what a vaccine does before the last year and a half. But vaccines, you need an immune response in order to fight off, to build in, if you're exposed to it, to whatever the infectious thing is. So if you vaccinate a pet who's immunosuppressed, they're not going to build up the appropriate immune system to fight off whatever they need. Now, there's some laws in the states you have to get rabies vaccinated. In the state of Pennsylvania, I was allowed to get a rabies titer instead of doing vaccination. So I would often do that. Unfortunately, rabies titers are extremely expensive, but it is, it's unfortunately those are our options. So
They're
it's
not that
not
expensive down here. They're not that expensive down here. But the thing that I have to tell you is that, I'm old, okay? And I was part of the parvo thing back in the late 70s with Cornell and University of Pennsylvania. And I can tell you that I vaccinate my dogs as puppies, and then I vaccinate them at like 18 months, and I titered them after that. I do not vaccinate dogs after that.
with Cheryl, Amy, I don't think she's writing as you read it. It wasn't a question. She's just saying that those are the causes of the problems: diet, vaccination, and environment. I think that's her opinion.
Okay, so the diet is absolutely can play a role in people. We know that in certain cultures, the Japanese culture specifically has an increase of gastric cancer because of the diet that they have.
Right.
Vaccination, I would disagree on that, except for we have injection site sarcomas in cats. But it's not vaccines, it's the injection. So it can happen in diabetic cats as well. We're getting insulin all the time. And absolutely environment. I mean, it's multifactorial. So when we talk about the science behind it, and it has to be at least an 8-step process in order to, that's what we say, it's at a minimum of 8 steps before a cell becomes, a tumor becomes malignant and grows, because it has to outsmart all of those checkpoints that we talked about. So it's very complicated, which is why whenever people, are we going to cure cancer? No, never.
No. Right.
100% we won't. But we can live with cancer, and our pets can live with cancer.
Right. Especially when we have oncologists like you.
Oh, thank you.
Absolutely. You are amazing. You're an amazing woman. You
Thank
are
you.
amazing.
I don't know if Benin, you want to address if anyone has a question. We don't want to keep Amy too long.
And poor Ingrid is 11 o'clock where she is.
Yeah. Sleep.
In the chat, I see 6. I don't know if that's all the questions that have been asked so far, or if the questions haven't all appeared. The most recent question I saw was the request to discuss the costs of chemo.
So that's really, really dependent on where you live. So when and it's even in the US, I would say it was quite different, because we're paying human cost for, the drugs. So like for me to buy a bottle of L-asparginase right now in Ireland cost about $1,000 or about 850 euros. That's one bottle that treats one large dog. That's it. In the States, it's about $200. And which is very unusual. But I would say if you're going to do it, and it changes all the time because, and the reason why I can't be very specific about that is because a company will make, like one company makes one of those drugs. And when they decide that it's not profitable, they'll stop making it. And another company will jump in and be like, I now can make a ton of money making and producing this. And so they jack up the prices. And so oncologists rarely have, we don't have much of a markup on our drugs because we can't. You know, we have to just cover the cost of delivering the drug because we have to wear all the special equipment. So if you're going to do a CHOP protocol, I would say I would expect if you're on a monthly basis, depending on what the protocol is, that you would spend anywhere from maybe $400 to $1,000. Here in Ireland, I would say anywhere from the least amount that you would spend is probably about 300 euros to up to 1,000 euros, maybe 900 euros. So but it depends on the protocol and the frequency. And sometimes clients will tell me they have financial concerns, and a drug that I give every 3 weeks, I end up having to give every 4 because they get paid every 2 weeks.
But do you know if insurance covers that?
Yes, they do. I mean, most
So
of them.
if we have dogs that, you know, are getting to that age, if they're covered by insurance, should we suggest to our owners that they do that?
Get
If
insurance.
if they're in one of those lines that has lympho.
I mean, it's too late once they have cancer to get insurance.
Well, before they have cancer, Or
I have always recommended that someone, and I'm sure I mentioned it too at the time in Pennsylvania that sorry, there was another question that popped up. I always recommend when people ask me, absolutely. The thing is when your pets are over the age of 10, there's a copay that is much higher. So there's still money that they have to put out. It's not covered 100%. So anywhere from 20 to 40% is paid by the owner as they get older.
So,
sorry, I just got Ingrid said that she was gonna go to sleep. Feel free.
Right,
I'm happy to
yeah.
answer any questions.
and I think if no one has a question, we should let you go to sleep too.
Oh, thanks.
Were there any other questions that came up?
No, that's it. I think Ingrid's was the last one. She's going, have a good night, Ingrid.
Thank you.
Yeah,
Thank you for all.
Thank you. Nice to meet you.
And Amy, thank you very much. Vanine, go ahead, take over.
Okay.
Thank you.
Well, if there are no more questions, rather than welcome everyone, I'll say at the end, thank you all for coming. Especially want to thank Mark for setting this up and Nishi for getting our speaker for Amy. And we had a second, Dr. Cindy, also very knowledgeable. I don't know all the names of the participants. I just see a couple names at the top of my screen, but the presentation today was on the behalf of the American Polish Law and Sheepdog Association, known as APLSA, much easier to say that. When we started as an organization in 2012, we made education and the health of the breed a top priority. It was our mission, and started a health committee about a year after we formed and wanted to take a look at what is this breed facing, and did an international survey. Ran it for 2 years in 3 languages, and the information that came to us said cancer is the #1 issue, followed by diabetes and allergies. So we started taking a look a little more as to what are the causes of death. And of course, being a health issue, cancer is our #1 cause of death. And as has been said, lymphoma is turning up as the #1 cancer in the breed. So,
Okay, may I ask you a question?
you may.
Since we're only like among a few of us, what's the incidence of diabetes in your breed?
Say that again, I'm sorry.
What is the incidence of diabetes in your breed?
It's not quite 30%. I have kind of a summary report from the survey. It's not up right in front of me, but I do have, if you email me, I can give you the actual numbers. That's the
Debbie
information.
can email you. Debbie can give you my info.
Yeah.
Because I've never seen it and I've been doing ponds since 2000.
Well, this is the information that was reported to us, and that's the summary of what we learned worldwide. We don't know the actual numbers of ponds worldwide.
Yeah.
So we're drawing a conclusion based on the information received, but those are the top 3 over 2 years reported to us as far as health issues go.
May I ask you something? You know, my thing is repro. Have you had any info that people are worried about it in your breed?
About diabetes?
No, repro.
No. I'm not aware of it. I've not had anyone say anything. It doesn't mean people are or are not. I don't know.
Wow.
That's a different question. I do know that pond breeders worldwide, the last year and a half since COVID, are not seeing pregnancies at the 4-week mark show up as an actual pregnancy after mating, after breeding. And
is that all over the world or in the US or whatever?
I'm hearing a lot of that is coming out of Europe. I don't know all of what the situations are in the US, but Europe is, in the last year since COVID came along, was seeing pregnancies not become real after the mating.
Wow.
Benin, I'm
Now
sorry.
that
Should
has
we let
would like to-
Dr. Carter Bay and
like to-
Ingrid go?
Yes, we're getting off on other topics.
Yeah, exactly. We're getting
No,
off the
I'm sorry,
subject,
but
right?
Yes.
that's my,
I mean,
guys.
when it comes to ponds, it's easy to have conversations, but I want to thank everyone. We do have hopefully a recording that we can make available in the future. I'll have to get together with Nishi and see how that turned out. But I want to thank everyone for their participation, their interest, and we can have future conversations, future Zoom meetings. Please, you have Mark's email address for signing up today for registration. You're welcome to send your thoughts to him, requests for future programs. We do this for all pond owners. We're trying to help educate everyone on the things they need to know or want to know about the breed. So Amy, especially for having stayed up so late and putting all this great information. I was trying to make notes and keep up, and I
was too.
No, I can't do that. But thank you so very much. Any other last comments before we all sign off?
I got a question that came across my screen. I have no idea where it came from. But it was for Amy, and it was somebody asking if there was any way, if they had like a question tomorrow.
Oh, that was Ingrid. Yeah, Amy read that. Amy read that.
Yeah, and I gave my email address, but yes, I'm happy to, I wasn't really sure exactly how to focus this talk because I knew there would be vets and breeders and all like different levels and stuff of knowledge. So hopefully I didn't bore you with my talk.
Oh, no.
But if you, I'm happy to answer any questions. It's extremely important to me to, I've been given this sort of, I love my job. If people say it could be depressing, I feel like I can give you hope and help educate. And teaching is a big passion of mine, which is why I'm at a university. So anytime if there's anything I can do to help, if you guys want more information about stuff, when time allows me, I'll be happy to share.
Thank you so much.
Thank you. It was lovely meeting you all.
Thank you, Amy.
for having
Thank you,
me.
Amy.
Good night. Have a good night.